Hi, my name is Jeremy Wehking. I'm a physical therapist and owner of Advanced Physical Therapy Specialists. I'm an orthopedic clinical specialist and a fellow with the American Academy of Orthopedic Manual Physical Therapists. And today I want to talk to you about knees and why they're clicking. There are a few reasons why your knee might be clicking when you squat, but I would like to talk to you about the most common reason. If it's clicking along the front part of your knee, it's most likely your kneecap joint. The fancy term is your patellofemoral joint. It's where your kneecap sits on your femur or your thigh bone. When you bend your kneecap moves down, and when you straighten your kneecap goes up. But it just doesn't go in a perfect straight line. It moves to the outside just a little bit. So you get a slight curve to the motion. This is in a healthy and ideal situation. When the kneecap gets pulled too far to the outside is when we start to hear a click and potentially start having pain and discomfort. So the next question is, why does this happen? Well, there's a few reasons for this, and a lot of the time the click and pain in your knee is just a symptom. It's just in the wrong place at the wrong time. Sometimes the mechanics at your foot can be causing it. So let's say your foot turns in just a little. You can put your knee at a perfect angle and causes that kneecap to get pulled a little bit too far to the outside. The other really common thing we see is a muscle imbalance or a weak glute muscle. When this happens, your knee will dip in and create the perfect storm. Even if this is happening just a little bit, it can put a small amount of stress, but very repetitive stress on your kneecap joint, on that patellofemoral joint. So the next important question is, what should I do about it? Well, you can do nothing, but I wouldn't recommend that because these things tend to stay the same or get worse and can interfere with your training or your work and start to impact your life. You can search up YouTube and Google and try to find the right kind of exercise for your problem, but I wouldn't recommend that because while it's great to be looking for an answer out there, there can be a lot of information and a lot of misinformation to sift through. And I would say it's a bad idea to self-diagnose. Or you can have someone take a look at it. I'm biased, but I would start with a well-trained physical therapist who specializes in these sorts of things. They should be able to tell you what's going on and what you can do about it. They should be taking a look at not only your knee, but also how your entire body is positioned and moving. And get you back on track. Okay, well that's all for this time. See you later. Thanks for watching.